They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real Nkomo Nketenkete. Nkomo biaye sesi chin. The as in takrenu assume the real Nkomo Nketenkete. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real Nkomo Nketenkete. What brabon tete? We nyan konkonsa. We the real Nkomo Nketenkete.
Yo, good evening, Obusiafo. The real Nkomo Nketenkete. Nyame adom. Nyame ede na watcho fofo nso ache biem. The time change na ba ye no ntino. Ebia time no aye kakra mawa. Sisi ya spring forward. Ena abo no nson 7 p.m. Ntino. Maiwa no yasan edru afidie no so biem. Yɛn nyinaa yɛba abɛtena se edi nkɔmmɔ abrabɔ mu nsɛm a yɛbɛtena ha na yɛsua adesua firi mu a ɛboa yɛn na naawɔtwe no nyinaa ɛyɛ sononko. Yɛyɛ yɛn ho adwuro. Anwummere yi, yɛn sister Gifty, yɛn sister Annette, ɛne yɛn sister Lady. Ɔmo ntumi amɛka yɛn ho. Na nso yɛnim sɛ baabi ɔmo wɔ biara ɔmo ho yɛ. Na ɔmo nyinaa so de nkyea ɛma mo nyinaa. Enyume yes nonko. Yewo yen Dr. Ochre, Prince Ochre, ewa hanum say, edu no swa. Mubehu Dr. Prince, into Dr. Prince, ye chiao ye mawakwaba. Yen sister Docas and so ewa ha. Sister Docas, onso ye mawakwaba.
And that's Selena.
The Drew sway, so when you be me drew ha, yes, straw say. Kaino, nakacha ne say. Nkomo na duru so na enyumere yɛwɔ Dr. Ochre wɔ ha die ɛyɛ adusuaku kɛseɛ sɛ eni kwan sɛ obiara yi ne ho firi mu yɛdi nkɔmɔ a ɛbɛyɛ abusua yie na yɛdi nkɔmɔ a ɛbɛyɛ apɔmuden so yɛbɛnya ahoɔden na yɛde atena se na yɛde abɔ brapa. Sister Dorcas na wɔtwi ɛkɔɔsɛn nyame de yɛahyɛ foforɔ ase yɛbɛma akwan na wama shout out na wakyɛ abusuafoɔ.
Yo, me that's about Selena, abusuafoɔ yɛ ma mo nyinaa adwo. Ebere a wobɛhwɛ program yi bia na yɛde ho nkyea soronko ɛne ma wo. Nyame adom na wɔtwe ɔde akɔ aba ɛno nti we can't complain. Na nwumere me pɛ sɛ me ma shout out kɛseɛ paa ɛma 1994 Sunyane Secondary School efrɛ no Susek year group no. And last month, a year group, you made back free move. So far, I think that she's the only one I have to see a year group into a call year. Nane, Yamia drum, you could see no assume dream when I hope 1994 year group no a show, you know. In fact, me her, not my heart was melted. Say, oh, yes, and Yamisha will be brave. Nane, Yamia drum, a doctor, yes, Ramo. Montwe konya na mometie ye efise apomoden ho asem na ye beka no ye young se ye betumi afiri mu saa na mum se betie doctor na edi nkomo a ebeboa yen ama nyankopon fie a wode ma ye no yetumi edi amen ye chia mu nyina mo amutie ye nyina. Sally, over to you, me that's
it. Yema mu nyina so 1994 year group no yema mo shedding say Lucy mo dear one. Dr. Ochre, I had a shout out. Into no, and may we a special guesty, Yabema Quine, now so den chia Emma Busia. Into the sun made the floor is yours. But you're muted.
Mese me da masi pii sɛ mama kwanya sɛ me ne mo ne watiefo nyinaa yɛ mɛkyɛ apɔmɔden mu nsɛm ne titiri the heart and also concerning cancer patients and so as the idea di kan me de nkyia bɛma me yere Beryl ɛm sɛ na wɔtwe mmiɛnsa a ɛtwa mu no ɔno na ɛne yɛbɛdi nkɔmmɔ about your oral health. Meso ɛde nkyia bɛma ɛm sɛ mowɔ hɔ deɛ the other Dorcas and sister Dorcas Poma, Dorcas Osuansa, and then Busia, Maryland. Say it was my day link na ama my busia or more over the United States, me my name busia, and so many now so 80 no more so benya bibi at the esua at the abobra.
Yɛda ase pɛɛ yie. Nti me nua, yɛahyɛ ase o. Twe akonnwa no bɛn ho na frɛ abusua. Yɛkyia mo nyinaa, Sister Nana, Sister Regina, UK, Sister Alberta. Yɛkyia mo nyinaa, Sister Judith. Mo a da bia no da nyinaa mo ne yɛdi dwuma yi, yɛde nkyia ma mo. Na enyimmerɛ yi, yɛdi kan anya ho sɛ yɛreba abɛyɛ yɛapɔmuden. Na apɔmuden no yɛ sononko. Yɛn doctor yi nua bɛrima a waba yɛfrɛ no Dr. Prince Ochre. Dr. Ochre yɛ cardiac oncology. Ɛno nti no anwummerɛ yi ɔbɛkyerɛ yɛ akoma no ɛho adwuma na afei nso wadivert no, especially yarebɔne a ɛrekɔ so wɔ wiase ɛyɛ cancer. Sɛ wonya bia na woyɛ treatment a deɛn na ɛyɛ akoma no? Ɔn sɛ wonum aduro bi wɔ hɔ nom a wakoma tumi bɔ saa na wonhu deɛ wɔreyɛ. Akoma no nso na ɛkita nipadua no. Nti me nua, adesua nyɛ adesua a ɛyɛ sɛ woyi wo ho firi mu. Saa mmerɛ yi yɛba abɛma Dr. Ochre kwan na wayɛ presentation na ɔreyɛ no. Me nua, fa questions bra na yɛnni nkɔmmɔ. Ɛyɛ nkɔmmɔdie. Sɛ yɛntumi anwie koraa no a daakye yɛbɛsan atoa so. Nti Dr. Ochre, yɛma wo akwaaba. Yɛda wo ase nso sɛ yɛtoo yɛn nsa frɛ wo na wobaeɛ. Nti saa mmerɛ yi deɛ yɛgyae ahama wo. Yɛda ase.
Me da masi pii me nua mpanyinfo Dorcas and Selena say ma invite me say mene mo ene yetiefo nyinaa yɛnkyɛ akoma ene cancer ho ade. Menim sɛ nyame adom ɔbɛnam kwan wei so aboa ma ya abɔ yɛn ho ban afiri yareɛ a ɛte si ewiase ɛso. Medikan aka akoma ka ho asɛm kakra bi na afei maka cardio-oncology no. Sɛ dosi kan no meyɛ cardiologist, but my special field meyɛ what we call cardio-oncology. Na meka ho asɛm kakra ɛne deɛ nti a ehia sɛ yɛn nyinaa yɛyɛ aware sɛ biribi saa koraa wɔ so ɛwɔ hɔ, because unfortunately doctor bi wɔ hɔ koraa na onim na refer nipa to the right person. I like to see the heart like a building, and I say a dine. I think that the simplest illustration is say I yes a dine. A dine be our walls, the bricks and the dino, the heart walls, and I said the myocardium. Oh, internet say command a walls no mum na a movie. So we could try echocardiogram. That's the walls. The second component is electricity. Te sɛ dan bi ahia electricity. Ɛno nti akoma no nso ɛwɔ generator. Ɛno na yɛ kind of pacemaker. Na afei ɛde electricity no akɔ dan no mu nyinaa. Na electricity no ɛfa walls no mu a ansa na akoma no atumi abɔ anaasɛ contraction. Nti sɛ electricity no nyɛ adwuma a contraction so intimi in a synchronized way. See, that's the second one. A hona say electricity ne ebi nye adwuma a obehu se obi se wanya atrial fibrillation. Anase obi wo ha no wanya SVT anase obi wo nso a wanya heart block. Now ye the pacemaker ashe na koma mu because generator no enye adwuma. The third component ɛwɔ saa ɛdan yi anaasɛ illustration ni ɛyɛ pipes. Ɛda obi uhia walls no, uhia electricity, ana uhia pipe. Uhia sɛ unum nsuo meboa. Akoma no so uhia sɛ onya nutrients. Nti coronary vessels. Ɛna ɛde saa ɛde nutrients no ɛba ɛne nsuo akoma no hia ɛba. Ɛno na sɛ unfortunately ne sɛ didi na yɛn didi yie na cholesterol ɛne etimi build it up na etimi akɔ fa heart attack aba because say instead say pipes no ɛyɛ clean no yet because it be a BBID and as other reasons in Tino, I blocked na pipe and sue woman and as a mojan intimi inflow. So when you a good understanding of just this simple illustration a beboa mo wetimi follow the now. Let me talk about cardio oncology right now. What it is. What is let me give a historical background. Say since the 1960s, Anna, cancer has been going on for a long time. But since the 1960s, Anna yenya chemotherapy and it revolutionized the way you share cancer home. And and saa enroi eboa ma cancer mortality na ekofom. One of the earliest medication, the friend anthracycline, and I said doxorubicin, na a year juma pa. But around 1970, and you researchers who say, a nipa omo fa saa duro no, omo tanya heart issues. And the ma any con home FDA 4 year research who said, oh, sa anthracycline no, your friend red devil. Anthracycline no, it me cause problem Emma akumano. Na nhwehwɛmu from that time no akɔsoa abedu this time. Na ɛno ɛna ɛkɔfa a ɛma yɛhu ɛnya anyimdeɛ sɛ chemotherapy no ɛnyɛ ɛnoa ne sɛ ɛsa yareɛ. Nti no from there no yɛnya new medications. Yɛnya tyrosine kinase inhibitors, ebi te sɛ imatinib. Yɛnya immune checkpoint inhibitors. Yɛnya aduro bebree Herceptin, but yɛhunu sɛ saa nnuro wei nyinaa no ebiaa ɛwɔ side effects. Ebi ɛyɛ etrinwi, ebi ɛyɛ different parts of the body, but akoma no so ɛyɛ involved. Unfortunately, no, until maybe the past 20 years, no, na unya cancer na uko treatment unfortunately na oncologists no na bebree ni nim akoma no ho ade nti sɛ ohun sɛ side effect no aba onim de also yɛ nti no sometimes no obi betimi akɔ treatment no mu nyinaa na wayɛ cured from cancer, but na afei n'akoma no wanya heart disease na wanya heart failure nti no nan sɛ ɔkɔyɛ anaasɛ wobaeɛ nti obi wɔ hɔ nso a yɛbɛhunu sɛ wanya heart issue no yɛde ne kɔma oncologist a cardiologist a na cardiologist no so sɛ ɛnea munyae deɛ moyɛ nyinaa na yɛgyae deɛ yɛyɛ nyinaa cancer no sɛ ɛbɛku no ɛno nti na ɛwɔ sɛ yɛnya a special group of people a ɔmo both the heart and oncology. Na afei you are not always trying to make a perfect decision, but you are trying to synthesize information, both the heart and the cancer. Now, what is the best for this patient? Beboa, not just with your cardiology knowledge, but with cancer knowledge. And in a nutshell, no, this is cardio oncology. Now, meaning say mama a brief introduction. Some people say kaka krabika ho ameti me kakra bia ka ho. Into the poster drug a kofa bae we still see it doxorubicin. Na ehin for na omotanya doxorubicin etade omomo enkran ketwa so munya CLL say omunya just leukemia lymphoma. In all the leukemia and lymphoma no, sa adriamycin no, a part of those regimen. Enti yɛde bɛma akra no ama cancer nako. Na cancer nako ani a ring a bell. Say why maybe I okay. Enti no so only akra no free hospital a ombese obeti hospital kra bio because wabre. Ampa so omo cancer through cancer ya no mabre. Enti sa any pay omunya adriamycin na adriamycin no timi mo for instance there's short-term effects, but most 75% of the effects no are long term. Into oya kran onya problem bia obi kra on kaise yɛayɛ biribi, but afei obɛdi bɛyɛ 2025 no, na afei 30 na wɔnya heart issue. Na adɛn nti na at the young age ɔstart any heart issue? Because or he's already predisposed to toxicity. Nti mebɛtaa in afei ma yɛbɛka other drugs akyire mo busa.
Okay.
How does that affect the walls and as a blocks no? Ɛno no aduro adriamycin ɛne aduro ɛte saa ɛtumi ɛma akoma no yɛ weak. Nsɛ sɛ bɔ sei no na afei ayɛ sei. Ɛno nea ɛkɔfa heart failure ba. Na especially obi a yɛma wo saa aduro no yɛsa ma radiation to the heart ebi a lymph nodes no. Ɛno nti yɛma radiation no. Radiation no nso ɛkɔ damage akoma no a na afei akoma no walls no ayɛ weak. How does that affect the walls of the heart of friends and the pipes? Radiation especially. Say radiation say would the yellow skin cry a benel skin. But say would the radiation no ɛkɔka saa coronary vessel no a na afei ama what we call accelerated atherosclerosis. Enti
Wow.
ebia yɛse wɔnom cigarette ɔnom ayi but already no inflammation no has been happening when no year 4 years and I said 10 years on into no or already no into no when you problem already. Yes, I quite bad lifestyle, but already and no it me affected the heart valves, radiation no. Into no one say heart valve no I calcify. It needs to say valve no it be nicely no na fe aye BBC into me ma afe na the problems about. How does that affect the electricity? It to me cause fibrosis ɛwɔ walls ni mu anti electricity no ntumi pass it through. Afei na otumi nya heart block na pacemaker etumi ɛba. Nti ɛnyɛ nkora no nkora, there's many other issues that we can address, but this is just an introduction into questions about a bit me a person mu and as more interest in other areas a bit me the aka ho asɛm.
But Dr. Otre, that's a pa. Now, me will lay man's a question. Say, akoma no the way unim akoma no si tie na was steady no. Na oka se pipes. Ene sa nneɛma wei na sɛ de nipa yɛ no nsuo yɛ kasa nsuo 60% of yɛn yɛ no nsuo a we can go no. Na sɛ okɔ yearly physicals a ɛyɛ necessary sɛ wobɛsa kɔ cardiologist or just to maintain a heart health anaasɛ wakoma no anaasɛ ɛno no deɛ it's okay sɛ wonni akoma problem a na wokɔ physicals a it should be enough.
Okay. I'll remember a simple answer and then I will actually maybe open it up a little bit more and give an expanded answer. The short answer is no. The short answer is no. And no because say we call physical examination or PCP no say me find say unique cardiac symptom to say wakuma enya we ya and I say pressure ultimately say there's pressure on your chest and I say ohumia insisiso and I say when I say a tie not those symptoms now there's usually no need say maybe echocardiogram any no. Usually it's not needed. But let me give you the real reason here we don't actually do that. It's called health economics. Health economics. In the society, we weigh the benefit of doing a procedure versus how much the society or the taxpayer has to pay for it. And so if we have to pay 10,000 for a procedure, and the research who say people at low risk, they don't get a friend saying this conditioner, then we ask ourselves, does it warrant say low risk patients will have this $1,000 test across the population? Then we say it's probably not economically wise. And so health economics really determines all this. But to answer simple, no, you don't need to do that.
Okay. Yo, Sally, my member Mukakra. Abusuafo, safe na wone ye edi dwuma a ka ho e. Na ne de Dr. Abayemba esan se there's a secret be or review actually. I think say as somehow can hear. And until link in sa one saka was suma unia bi na ono so entie bi. Esan say so the doctor came it ya see pa dia na ekire say wunya cancer na ye treat wie a ebetumi de akomayare abrɛw in future. So woyɛ akora a bia na hɔ na de treatment no benya na emom daakye bi no ebetumi ama akoma no ayɛ mmerɛ. Saa na mete ase. Sɛ saa na doctor ɛkyerɛ de a ɛneɛ na behu bi yɛ aba me mu kyerɛ sɛ yɛwɔ yare ahodoɔ bebree bi so wɔ hɔ a bia na yɛ wogya treatment a saa treatment na wɔn nsa ka no etumi ha akoma no doctor eni hɔ saa na.
Oh, and there are other treatments a timi ha akoma no. And until when we FDA approve a draw, or more look at a friend is saying baby phase 1, phase 2, phase 3. Phase 1, phase 2 no more share how a drone the side effects and is saying na the side effects no it warrants say a drone a babon tiana and almost share a lot of the drugs no out because a drone it be affecting some systems. The difference with cancer drug they say a drone bi wɔ hɔ a ɔmo nim sɛ ɛbɛtumi affect akoma no, but there is no better alternative. Example, aduro bi yɛfrɛ no Herceptin. Herceptin sɛ especially ɔbaa wonya breast cancer na ɛyɛ HER2 positive. Wonya breast cancer na ɛyɛ HER2 positive a the gold standard of treatment ɛyɛ Herceptin anaasɛ trastuzumab. Na yɛnim paa sɛ trastuzumab no ɛtumi ma ejection fraction ɛkɔ fam. Ɛno nti no FDA mandate sɛ obi a ɔbɛma trastuzumab bia no yɛyɛ echocardiogram every 3 months.
Okay.
Every 3 months. Ɛmi hu sɛ ɛmi yɛhwɛ sɛ wakoma no ɛda so yɛ okay anaa. Sɛ ɛnyɛ okay a ɛne ɛwɔ sɛ yɛde kɔma obi a ɔyɛ specialist na ɔtreatu na yɛhwɛ sɛ ɛwɔ sɛ yɛkɔ so a yɛnim but yɛnhyɛ dɛ ni other way be a yɛbɛtumi ama therapy apart from hydro no nti ɛno ne difference no nti yɛhwɛ the severity of the disease na FDA ɛde agyina so sɛ yɛnim sɛ aduro yɛbɛtumi ahaw but for now no it's our best option.
Okay. Yeah. So doctor sɛ mɛsi ate wase yɛ deɛ a na kyerɛ sɛ ɔmo yɛ nkora na deɛ a cancer no bɛtumi akɔ na akyire wanya heart problem no but sɛ wanyini na yɛ treat you for cancer deɛ a two ne nyinaa no bɛtumi akɔ so at the same time a yɛma treatment no o heart no bɛtumi anaasɛ treatment no bɛ complete ansa na heart na start sɛ more problem.
A good question. Let me delve in a little bit. Cancer, no, friends, and chemotherapy, it be different. Okay, chemotherapy be different. Now, chemotherapy na affecting in the akomano, it be also a year juma differently. And what the way I affected akomano. A drop to say anthracycline, the medical cancer, and then the poster child. And no, usually no, it happen. The effect no, it happen. Usually about 10 years, 15, 30 years, depending on, if I say Accra, it be 20 years or later. And sana won't know. Now, so we a penny, maybe our breast cancer, and I say other cancer, no, you use anthracycline, so also bet many be along the line. It be a sir. But me find say, or beyond your breast cancer, you do Herceptin. Herceptin, a tie, a happen. Toxicity and as a cardiac toxicity, no, it happen right after say we doing say we treatment, and I said right after. And usually agent so one thing that make say interestingly the risk factors for most cancers is the same risk factors for heart disease. This diabetes, hypertension, a lot of in general, most of the risk factors for cancer and the risk factor for heart disease, are not a tie, the same. So a lot of the patients cancer therapy, the older ones, they tend to have but it be brain tie already some issues with the heart. Into no almost sound cry there. Before so best therapy as no, it didn't be me. Say, can you evaluate this patient? Then your risk assessment. We know a even safe say be so a drawway. And often no say if it's not a draw, any alternative be a because say, well, let's try it. Na be a instead say obi a share or only be returning every 3 months. Make us say it be every month wo bra. Na yen hwɛ sɛ de wakoma no ɛsi ayɛ because like I said we don't have any better effect. Ebi wɔ hɔ nso a we have alternative. Ɛka sɛ sɛdeɛ akoma no si teɛ no I think sɛ wɔsi yɛ sesa saa cancer duro yi. De bi a me ne cancer doctor na akasa sɛ we ntumi tolerate saa aduro yi. But sometimes no mehunu case bi wɔ ha menya no na akoma no ayɛ weak awie because the cancer doctor didn't reach out no was aseɛ no wɔyɛ deɛ ɔyɛ because ɔno drink cancer no nko but nti mehu patient no na akoma no ayɛ let me give you an example. Me share I came to UT Health San Antonio to start the program here. Now one of the first patients I menyaeɛ no na ne ejection fraction when me say heart squeeze. Okay, heart squeeze. A normal heart squeeze is about 53 to 70%. Okay. On only the na ya mana came on near draw na ne heart squeeze na bear 20%. Akuma ne buse. No modi ne bre me say main optimizing no na onko ontimi and cancer treatment. There was no way I was going to tell them to continue because the heart was so weak. Nti mehu no and many omo bekasa within 2 or 3 days and a patient passed away. And like I said, you have to look at both, issues. The one here, you push for the cancer and it had to be under control. Till we have to work together when, and we don't want to work in silos. Yes, sir. The patients, they be at risk.
That's it. And Dr. Oche, not just say patient be bow while the patient be on or so many underlying conditions and sana ebia cancer so edin ho ejim. Said ye would about diabetes, hypertension, man and so no say it will effect our heart no so already.
Yes.
Okay. No so no a massa erection echo form
Ejection fraction. Okay. A very, very good question. A very, very good question. One of my main goals, and I said one of the main things are also me as a cardio oncologist, and I need to do a risk assessment. Also me risk assessment for the patient. Oncology bomb very, very good. Omunim say patient way a drama be a hectic on the heart internal. I don't know everything, but I know say there's somebody who is a specialist here or the patients in the baby no a risk assessment. Into risk assessment, we age, especially when you are very old and you are very, very young. Also, when you're younger, come on, still develop it. They are very susceptible to injury. The older you are, also usually very susceptible to injury. That's one thing. Unfortunately, being black in this country puts you at risk for toxicity, especially with anthracycline and Herceptin. Being female, okay, diabetes. So diabetes affects baby. Diabetes, any obesity. Say do that and also etimi ekofa problem bro during this time. The other thing is that so already where the kind chemotherapy for so where the kind chemo be in the past and no ekofa more issues bro and I said yeah radiation our command before and also no etimi kofa more issue bra now all existing heart disease and it raises there's a few protective factors. Yeah, let's cap obi catch him say otimi or to America 5 days a week. Or otimi call like 1 mile, 2 miles. we have studies, good studies that have shown that those who exercise during cancer therapy, they actually do better mortality wise after cancer therapy. And you know, we definitely do risk assessment. And sometimes after the risk assessment, I just say, go ahead. After risk assessment, I have to call the doctor. Say, we got to be very careful with this patient because the baseline and good. And usually, no, we have to talk to the patient who said, this is your baseline. I expect say yeah, the heart will get weaker during this treatment. And sometimes no, and not to me boa MIA to me the omoto edrubi so I to me protect akumano during the treatment. There are medications that have shown to have protective or if you find cardio protection during that time.
Okay. Yo, doctor, where the kasa yi na yɛpɛ kwan bi so anaasɛ yɛpɛ sɛ yɛtu yɛn nuanom Ghanafoɔ yɛma yɛ information. Sɛ yɛn nua bi receive cancer treatment bi a, sɛsi a yɛnya information yi, yɛbɛtumi apɔɔse aka akyerɛ yɛ doctor ne sɛ ɔma yɛn cardiac na ɔnhwɛ yɛn ehu sɛ treatment no sɛ yɛhwɛ na sɛ ngo sɛdeɛ woka yi a, can we challenge our doctors to do that before we continue our therapy? Anaasɛ yɛnyɛ nwie, mebisa question ama yɛn nuanom a bi a na biribi nti no ɔmanya cancer yɛtreat wɔn mo. Sɛsi information a yɛka kyerɛ sɛ treatment no bi wɔ hɔ a ɛha akoma no, but bi a na yɛ doctor a ɔretreat yɛn for cancer no ɛnyɛ any suggestion about sɛ yɛkɔhu sɛ yɛakoma no gu so ɛyɛ adwuma anaasɛ ɛnyɛ adwuma. Ɛnna a wo ne yɛn ɛyɛ saa adesua yi. So, yɛwɔ saa akwanya no sɛ yɛtumi ka kyerɛ yɛn doctor sɛ yɛnya knowledge bi sei enti ɔnkyɛke anaasɛ ɔmo yɛn nkɔnkɔhu cardiac anaa.
A very, very good question. I think that the first thing I would say is that you always want to work with your doctors. Work with them. You don't want to butt heads. I think that is very important. But the first thing is being like having the knowledge. Number one, having knowledge and asking questions. One thing with medical field is say when you ask questions and you know certain things, doctors are always careful, or they always treat you better. Unfortunately, that's the truth. Okay, so work with your doctor. And what number one thing I would say is say ask your doctor. Say, I am receiving chemotherapy. Tell me about the cardiac side effects of this medication. A lot of times, no patients need number one, obinya cancer, and I see patients every day. The diagnosis itself, no, is overwhelming. From there, no, also radiation therapy, also surgical oncologist. Say it's a lot. Now, if you also have here cardio oncologist, it's a lot. The work where you catch in the crana, the bohana like it's a cause somewhere. Say, or it can have an effect on the heart. But being aware, saying ubusawa doctor say a drawaway, no, what is the effect on my heart on the heart? Because like I said, no, there are some that are notorious more than others. It's not very and shadang and command too much. And to just work with it, ask your doctor. So I say I will look into it. That's fine, but you also look into it. Say a drone is saying, or say I'm on chemo. Well, chemo is not a drug. Chemo is a class of drugs. What's it about national? And yet drug chemo uka chemo unka here. Waka say no so it said I'm taking medicine. Well, what kind of medicine? Any side effects? And that's what I would say know the chemo, what chemo I am on, am I on, and at the end that way no, then you can have a conversation. But some say in this hospital, do they have a cardiac a cardiologist or a specialist? Ewo akuma. A friend say, our cancer doing cancer therapy. Important questions are over to me, Ebusa. And I think I work with my oncologists. I always make sure that we are working well together, we are collaborating, because what you don't want is that ways to say. It's at the end, is the patient that suffers. And you don't want to stop your chemotherapy and before going to ask questions, because some cancers are very aggressive. And so I would say continue before and then ask the question.
That's it. Also, Dr. Autry, edro no a ɔka no sɛ edro no mu yɛ dunti. Mimi ntumi mbobɔ edro. Edro no bi ba. Na ɔka sɛ edro no bi wɔ hɔnom a ɛnyɛ good for the heart because ɛbɛma heart na ayɛ more weak. Na unsɛ sɛ wowɔ blood pressure sometimes na ya no ɔmo ka sɛ ɔmo ma blockers sɛ eduro no bi wɔ hɔ ɔmo bɛma wo na aboa wakoma no aboa your friend is saying or
Protect the
pulse
heart.
how wakoma no ABC because older blood pressure during so for a long time it can affect the way our wakoma no so no ebo. Into no the same thing with the cancer drugs no mutimi mix and match mobitimi a mix it na maboa patient and say one is helping the heart fraction no more beat well and at the same time no treating the
Blood
disease.
pressure, no.
Yeah. No, like cancer no drugs no mobitimi a mix it to say blood pressure there now
Can wait me afa adrenaline abo?
eduro ni mienu abom
Oh,
because
okay.
two blood pressure medications so yes num way because we be boa we na we so aboa we one mix it into no cancer drugs no mutimi yen sa na
Mehu the okano. Usually, like a very good question. Most cancer medications, like I said, it's a combination. TCHP, RCHOP, a drobaya 4. Na boom. Yemfa heart medication and mix it. Sa adrono. We don't really mix it. It doesn't mean that untimi entiki adrenaline whilst you are undergoing therapy, but during the infusion, no, that's not what we give you. But yes, adrenaline is a beta blocker. Is a okay. Obi wo hona mehwe meye number one meye risk assessment. Na me hu say the risk for toxicity na high. Na so we di kan enya issues maybe or diabetes or high blood pressure. Me expect to say ebia na come a bit my weaker. Instead, say be a kofa amlodipine, which does not really help with the ejection fraction. I will use another blood pressure medication. It may not be the strongest blood pressure medication, but it actually is doing two things. It's working well to reduce, for instance, toxicity, and also to preserve the ejection fraction, and it's also helping with the heart. But ebia and not only the best blood pressure medication, but I'm using it for a certain purpose. And to drop is carvedilol, to say bisoprolol, those medications we use it. Like synopronate, unfortunately, sometimes would they obia to a drop for cardio protection. No? Obeko PCP na PCP na yine free so. Oh, we need blood pressure. Me say man to so say may preventive blood pressure. I want the heart to be well. And sometimes you need to get the PCPs to be aware. We need to be very clear. Say this is not an issue with blood pressure. I am trying to save heart muscles here. So before say obey jaya drug cardio-oncologist and cardiologist, you have to talk to them. And we have medications that we can use to help with cardio protection during that time, before, and also the heart may say ejection fraction maybe at 52 to 79 normal. Now, have patients currently like that or more heart and they say 45%. I reduce it, but what do you do? They are on the best medication. Their cancer is aggressive. And we will have a conversation and we say, let's continue. But let's keep a very close eye on this patient. Let's make sure say a draw interest to or more a draw a bit me a heart it me back up and I say a bit protected the heart whilst we are taking a risky step. It's really trying to do the best, and there's nothing perfection here.
How do you strengthen your heart muscles?
Yeah. So answer now my doctor here no doctor penso bi no my yenko commercial break it's way bi na ya ba.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present the real Nkomo Nketenkete. Nkomo biaye sesi chin. The asentakre no assume the The real Nkomo Nketenkete. Showing live this and every Sunday, 7 p.m. on Era One Radio on Facebook and on YouTube, Era One Radio and on Taibo channel. Kaise, so we see the real Nkomo Nketenkete a what brabon tete. We nyan konkonsa. We the real Nkomo Nketenkete.
Yo, abusuafoɔ yɛasan aba biem. Sɛ wonya joine nkɔmmɔ yi a yɛserɛ na wommɛse education bebree. Akoma no ho asɛm na yɛsua. Question bi a wɔ yɛwɔ Dr. Ochre wɔ hanom. Dr. Ochre ɔyɛ specialist in cardiac oncology. Onim akoma no ho nsɛm yie. Nti no question no ɛna ɛyɛ bad question. Question bi a wɔ biara wode ba a Dr. Ochre bɛboa na wayi ano. Enwumere esua kwan a yɛbɛfa so a akoma no wɔ eduro so a sɛbio society mu cancer ɔne yɛ edi ne nya. Wowɔ yareɛ yi bi a wowɔ eduro bi so a kwan bɛn so ɛna akoma no nso betumi anya ahoɔden. Ɛno nti no frɛ wo nua bi na ɔmmra na ɔno nso metie bi. Na before the commercial break no, bisa question bi sɛ wobɛyɛ dɛn ɛna wa strengthen or cardiac our heart muscles. Wobɛyɛ dɛn like woyɛ normal person. Ebia koraa na wonni eduro so. You think say your heart is strong, but meanwhile na akoma no yɛnnim what is inside us. Nti yɛnnim deɛ ɛkɔ so. As we age no so no, from your talk no can say wonyi a ɛyɛ weak. Nti no wobɛyɛ dɛn ɛna yɛama no anya ahoɔden.
A very good question. If I may correct you, we are susceptible to injury.
Okay.
And I say it's susceptible into and these are risk factors, and it doesn't mean say be a winning by when you know next what come I week. Okay, that's the only thing I'll add. A very good question. The same thing I would do for my cancer patients is the same thing I do for my non-cancer patients. Number one is really lifestyle. The inside we already even before we knew about all number 4 a day vegan, but we already knew about the health message. And so what we are eating, the fruits, the vegetables, are very important because it's with that you don't have cholesterol in it, right? You don't have cholesterol in it, and you don't have triglycerides. So the more we are eating those healthy food, the more once a pipe, it doesn't get clogged.
Okay.
So that's very important for the coronary health, and also it helps to maintain good weight as well. And of course, exercise. Exercise very important. The recommendation is 5 times a week, 30 minutes. But anything that you can do is better than nothing. And he said 2 days now, a year or 3 days, it's better than something I said. When you 5 days into definitely exercise is going to be important for so many reasons. Cardiopulmonary fitness is going to be important for your muscle health as well, because say so now your muscles it does decrease. Now your strength a decrease. And that's going to be important as well. Exercise, like I said, even in my field, those who exercise they live longer during therapy. That's important. And as we are maintaining good weight, we are also keeping diabetes at bay. Say diabetes a risk factor for heart disease, right? And why is that? Because diabetes induces inflammation everywhere, and you need inflammation to have coronary disease as well. And so when you have diabetes, it's very interesting. Say, if you do what we call catheterization, and I say you could try picture heart vessels now. You did die. It will be you did die. Share will be arteries. You didn't share X-ray, moving X-ray need track a year. Will be all cancer. No, the vessels no are very tiny. The vessels only are very tiny, and that they have multiple blockages. And to say maybe a healthy vessel but one blockage. Diabetes causes what we call multi-vessel disease, and a lot of times uh, usually they tend to need bypass surgery. Also, you be a kumano yeah, it be from the leg and put it. And so those are some of the important things that we can do to maintain health. And if important rest, like normal psychosocial issues like stress management, rest, very important, and and sleep. These are all things that are very, very important. And of course, hypertension is everywhere. And it's important to mention say mhm, there's a correlation between sleep and hypertension, right? Because when you sleep around 4 hours during REM, now, your diastolic blood pressure will decrease for a long time, and that kind of helps to reset your blood pressure. Ɛnti na obi wɔ ha a ɔyɛ adwuma anadwo dwuma na ne sleep no all over na they tend to have higher blood pressure. Mhm. Ɛnti no, continuous 7 hours really average 7 hours, but 6 to 8 wobɛtumi a 8 it really sets your blood pressure as well. And the other things that we can talk about, obi wɔ ha I can see them and it says so you have sleep apnea because ne weight no na ne corner kɛse no, you can already tell they have sleep apnea and they snore very yeah. I can tell you how much you snore. Like, oh, my wife says I snore. Not just the snoring, but
Disturbing your sleep.
well, they stop breathing from time to time. Okay, and no, they not just the snoring, but they're stopping the apnea, which is periods are cause silent for a couple of seconds and then it comes back. During that time, the oxygen tension in the heart, in the vessels feeding the heart or pulmonary veins, a very low oxygen tension, and none of it induces what we call free radical reaction, and no and atrial fibrillation and other things. And weight management, and no prevent sleep apnea, but who sleep apnea, and I said, oh, very large. Now, when we could check it for sleep apnea, I think that it's very important to check it.
Yeah.
Yeah,
Where the doctor.
with the mpacho question about
Uh-huh.
young brother Lawrence Edu or say question heart no ne cholesterol now boss no a one and question wo or say or bad or call ne physical some say or bad cholesterol but doctor no catch and say only enyoma bi ebema ne good cholesterol no akosro because na bad one no is so high. Nti no ɔmaa no nnuane bi te sɛ avocado ne nuts ne adeɛ but odiiɛ no ɔkɔɛ the following year ohu sɛ bad one no asan increase biom. Doctor no explanation ne sɛ because bad one no wɔ soro dada no nti no odii good one no koraa no ammoa nti no wayɛ confused nti no is that something a obetumi ayɛ to reduce the bad cholesterol na and I
Very-
Ivy me carbon said the bear time
okay. Okay.
or say okay sleep to reset blood pressure but also on shedanya continuous or
Mhm.
that any tia chance na wetimi ada biem
Mhm.
nti no obese n'ani bekom no na ade ache nti no in that case no from what time no betimi ada are helpful for the heart. It was specific time before um during the night. Say would be a you
Mhm.
cast off bed before 9 p.m. and not 10 p.m. Obe a bit me a help it na come na into no that's all.
Okay.
Yeah. We have a question from yeah, I say Adam for Millicent.
Oh.
Or until we are made better also.
Mate, let's take the first one. Everybody has good cholesterol and bad cholesterol. Everybody has some. The question is not whether you have some or not. The question is what level it is. What did the Bachelor say?
Mm-hmm.
So we already have LDLs, okay, and then kind of bad cholesterol, and then we have HDL, which is the good cholesterol. And these are actually things that the body needs, like your body needs to function, but it needs to function. For instance, the levels need to be within a certain.
Orange.
It is not true that treating your HDL will reduce your LDL. Okay, It is not true that treating your HDL will just automatically treat your
Reduce.
LDL.
Mm,
That's not true. And so if the fact that you have like cholesterol LDL of, let's say, 250 does not mean say okonom avocado where LDL will come down. That's not true.
mm,
So you need to get second opinion or see, and even they actually cardiologists that specialize in lipids. Okay,
mm,
or even like some people who specialize in lipids. And I think that if you don't take care, you will have it for a long time and you have more effect. And so the way, number one, the way to do LDL, um, like we say, lifestyle, it's basically if it does not walk, if it does not have eyes, it doesn't have cholesterol.
mm,
Okay, if it does not walk and have eyes, it doesn't have cholesterol. And the more legs they have, the worst. So that's why fish is better. They have no legs. They have eyes, but they have a little cholesterol, not too bad. Chicken definitely better than others, and then beef, four legs. And so if you really think about it's a simple way that I usually explain to other people. So the more green, the more things, the fruits that you are using, the more you are reducing the LDL levels. Okay, and that by itself increase your HDL levels. But if you are at a level where your HDL is so higher, it's really requires a lot of times, no, it'd be a bit tricky starting for like even a year to really bring down the numbers. And then it doesn't mean say you have to continue forever. Okay, sometimes you need to start with starting to bring it down, and after it comes down and you think say you can use lifestyle alone, then you continue with lifestyle alone. But obi wɔ ha, the numbers need terrible, and so just using lifestyle alone is not enough. And so
Okay.
like I said, I don't know what numbers he had, and so number people ha, like I only tell them I think you can use lifestyle alone if you can. But people ha make us say no, this is too much. Just like blood pressure, number people ha is so dangerous. Say I will take you I'll tell you to go to the ED. But number people ha we can work with, and number people ha like it's a bad but and yet too bad. Using other ways. Let's talk about the sleep. Now, coupon there's a way I see boy and there's a timer, like melatonin rises at a certain time in the dark, and when it's dark, and then it falls during the day. And so those are the optimal timer, like 9:30, and those are very good time to go to bed. And usually if you can sleep around that time within 3 to 4 hours, then that's when the diastolic dip, it happen around maybe 1 to 2, right? But it doesn't mean that that's the only time. But if let's say you work at night, now to me that continuously around for 3 to 4 hours now, you can still get the diastolic dip. But we know, say, um, those who have erratic work schedules, they tend, on the average, not obiao, on the average, if you take a sampler, this is epidemiology. If you take a sampler, their blood pressures tend to be a little higher than average. And so look into what we call sleep hygiene. You can even just Google sleep hygiene. How can I make sure say my sleep can be regularized, like taking TV away from the room, just maybe meditating and doing things that will calm me down, reading the scriptures, just like and just doing something calming, breathing exercises. All
mm.
those can really set your time, and not having like computer in the room, because that can stimulate the eye. And no, the eye is very awake and a phone. It sometimes it won't let you sleep.
Okay. Yeah, that's a doctor. Yes, sister Millicent or your fan your show yi so and the last week granny and no so na nasema o de buy and say onim say ona osua say yes say wo pain left arm mu a sometimes na bibi about your heart. Akoko the doctor, your man na stress test. Everything shows okay, but onya pain still ne arm mu. Onye den.
Okay, so I am not going to be your doctor, and I will only give you general advice. Okay, so the heart has nerves, right? It has had nerves, but these nerves are the way we feel heart pain, what we call referred pain. It refers to other areas. It can refer to the jaws. It can refer to the the shoulder, to the arm, and to the back. So those are areas where the heart can refer pain to. And so if a patient comes in and they're having chest tightness and maybe shortness of breath or more nantia, then we will ask more questions. The question is, does it happen when you are exercising? Because that tells me say the pipes, into me and supply well during when you need more blood. Does it happen when you are just sitting down? All those are very important questions. Now, don't if we have to rule out very dangerous things, like you said, like a heart attack, by doing stresses and other things. And a lot of times we do stress tests and there's nothing. Okay, don't forget, say what one sano or shoulder and answer one sano can also have its own pain. What's it in I say? You can also have pain, like it also has nerves, and so you can also have pain on the shoulder that is unrelated to heart issues. And the good thing is that doctor so on like say if you come and your symptoms are not very typical for heart a year, and I have you do like a stress test and everything, and it doesn't show anything. Usually, no, we will just monitor you because you didn't show any cardiac issues. And yes, it's always important to rule out the heart, but you can also have like boa oko fro before and costochondritis. We see all that as well. We see other things. That is not necessarily heart pain, but you never want to downplay heart pain, basically.
Okay.
So you did the right thing. You went to get see your doctor. They did a stress test. Nothing showed, and so I think that's a good. But one thing is that if you already have very high levels of risk, if you tell me you are 70, you are male, you have diabetes mellitus, you have hypertension, you have very high cholesterol, and you have heart issue, a lot of times I won't even stress you. I'll take you to the cath lab because your risk levels are too high. And so the stress test is an intermediate test, and it does not always confirm everything in everybody. And so in a high risk patient, take them to the cath lab and look at it using a gold standard, which is the the catheterization.
Okay. Doctor, but that's a million where there was 20 what? That only your age group until
Okay.
70 the owner.
Okay.
But that's not doctor where the mere median. When say we start actually a command see the city no, who can say the electricity in the wall, then so. Me you be a minimum so pa. Na in so na minimum no. It disturbing me sleep anayo. It sounds say me to me sorry be 4 times. It use bathroom. Me nyan so no.
No, I
And
would
I say, menko so no.
no. Ube to me. So let me answer this in two ways. Number one is say akomano. So boy it's a heart failure, right? It's obi oha a man in num so be say me kwa sorry SD for you say me num so bebre. Na the internet doctor you say mama num so. But this is obi a makosra no wonya heart failure me busa no. Sorry, yes, me no nsuo bebree. Em say obi so be sra no de temperance brand no say no nsuo bebree. Menuanom me nyɛ careful. If you are not a medical obi a ɔyare ankasa no, be careful what you are telling them. Me say it say pipe no. Even pipe and nenam ye fie there's a pump somewhere. Meboa. Air pump it.
The pressure
Yes,
is so neighbor.
that is like the heart. Nti no ɛno na ɛyɛ saa. Na akoma no yɛ weak a ntumi mpɔmpe nkɔ anim. Nti ɛbɛkɔ fa, ɛbɛkɔ akyire. Ɛkɔ akyire a ɛkɔ lungs. Lungs no ɛwɔ sɛ mframa na ɛwɔ mu. Nti nsuo no ɛkɔ mu a na afei wontumi. Nti na yɛ limit how much obi a wɔ heart failure limit how much also nom. So that's one thing. But if your heart is normal, you can drink water and your heart will work it and your issue. The only thing that I would say is say just time the time I want to you can also alter it. You know, instead say open no
Hello.
yeah
Dr. Pacho, 1 minute. Hello. Me Pacho, be online so. Me Pacho to us.
okay.
I'm going
And
to
so
call.
instead say open no throughout the day. No, you can start very heavy in the morning, and so by 3 no maybe one no more.
Yeah.
Now if you after that no you don't before some no not why we use the same technique with diuretics and also water pills. Instead say bema nanom no be at 7 no one no 6 no usually I will have the last dose to be around 3 that way no or down on not end disturbing sleep because you also don't want your sleep disturbed like forever into you can just use that little like adjustment.
Me that's it.
Yo, Dr. Ocho, yɛda ase paa. Yɛnim sɛ yɛ time no sa. Nti no, wei deɛ, Nyame yɛ adom a gye sɛ wohyɛ da ba ɛbɛtena ase na akoma no the way a ɛyɛ adwuma no, wokyerɛkyerɛ yɛn ne stages na yɛhu. Ɛsiane sɛ yɛhu sɛ exercise bɛboa yɛn. Ɛna yɛhu sɛ cholesterol no, yɛn brother Lawrence, yɛnim sɛ wate answer no, wo increase good cholesterol no ɛnyɛ automatic say o bad cholesterol no nso ɛbɛkɔ fam. Ɛno nti no ɛkyerɛ yi hu yɛ a ebi a na yɛde doctor number na ma wo, na questions bi a wɔ biara no watumi abisa no. Yɛhu sɛ sleep nso ho hia. Ɛna enwummere wakyerɛkyerɛ yɛ sɛ yɛn nuanom a ɛwɔ cancer eduru a yɛde ma wɔn kwan yɛ fa so akoma no na ɛtumi alter ɛyɛ good adesua pɛɛ yie. Nti yɛbɛhyerɛ sɛ sɛdeɛ yɛne Dr. Oyere Beryl ɛyɛɛyɛ no yɛne ne wɔ appointment foforɔ. Wo nso no yɛnim sɛ wobɛba back na woaba abɛbiebie akoma no ani so akyerɛ wo na questions bi a yɛwɔ biara no yɛtumi abisa wo. Yɛn sister Rebecca Danso ɔse great show yɛda ase. Ɛyɛ adesua kɛseɛ pɛɛ yie na yɛnim sɛ yɛn nyinaa yɛnya bi afiri mu. Ɛno nti no abusuafoɔ aha na dwumadie no yɛde bɛsi. Sɛ wo joinee yɛn a na wo nsa ka link no a yɛsrɛ wo ayɛ a na wahyɛ ɛsiane sɛ ɛyɛ education. Yɛyɛ yɛn ho adwuro, yɛyɛ yɛn ho adwuro. Ɛno nti no yɛgyae ha ama doctor na ɔde ne summary ama yɛn enwummere program no na yɛwie a na yɛde dwumadie no asi. Ɛno nti Dr. Mpakyɛw bɔ ne tɔfa ma yɛn.
Yo, me nua mpanyinfoɔ meda mo ase ɛwɔ akwanya a mode ama me sɛ me ne mo ni nkɔmmɔ ne mo atiefoɔ. Ne tietia ɛne sɛ akoma no ɛyɛ special organ a Nyankopɔn ɛbɔɔyɛ. Sɛ dɛm sika no ɛwɔ walls, ɛwɔ pipes, ɛna ɛwɔ electricity. Na aduro bebree atumi nya ɛso nsinsansoɔ. Na de titiriw ɛyɛ chemotherapy. Na chemotherapy no ebi wɔ ha yɛnnim sɛ aduro bɛtumi aha akoma no anaasɛ ɛbɛha akoma no, but we don't have alternatives. Number one sɛ yɛ aware wo chemo no does it affect the heart? Or risk level ne sɛn? Ɛne wo doctor ne nkasa na ɔma wo be a cardio oncologist so wo fall into that risk a hunu sɛ waduro no does it have long-term side effects? Now, ɛwɔ saa deɛ a then you need to be in a cardiac survivorship. The risk factors are ɛma wo toxicity level no yɛ high no. This age, extremes of age, low and very high age, high blood pressure, diabetes, dyslipidemia, and that's a high cholesterol level, not exercising enough, already being exposed to another chemotherapy, and that's a radiation. Say akomano is share for instance breast snatching. So we are left breast survivor now with the radiation and also to me combined. But what we can do is the same thing as what we do in lifestyle. Make sure that we are keeping good cholesterol levels. Make sure say your LDL no, your low, your HDL no, your high. into lifestyle, and if you need medication for a while, I think it's not a bad idea. Maintaining good blood pressure. I didn't talk about it, but some medications, chemo will cause your blood pressure to be high. And also say it is my doctor enya aware, also doctor yeah aware. No to me mom do now blood pressure now 200, 230. And also yeah one thing. Exercising during treatment. And even so when you cancer patient crying, exercise is definitely going to be very important to help with your cardiopulmonary fitness. Now they say one they may I'm sure said there are other people I walk around and he said unim will be now or go through therapy and maybe some information on where you can contact some of us and then we can advise on what to do with the massive P.
Yɛda ase. Nti ɛneɛ na nyame yɛ adom a dasɛnnɛ yɛbɛsan ahyia nti no
Yeah, Dr. Ne, that's very.
Amen. Amen.
They are four women. They are beautiful with brains. They are eloquent, decent, wise, and experienced. You have heard many, the funny. Now, it's time to hear the experience and the brainy. Meet Selena, Dorcas, Gifty, and Annette as they present